Let me tell you something that happened to a 71-year-old man named Harold. He went into the hospital for a routine knee replacement. He walked in healthy, mentally sharp, and completely independent. 3 weeks later, his family was fighting with the hospital over a bill they never expected. He had developed a dangerous infection from a catheter that was left in too long, and he was confused, weak, and terrified. His daughter told me, with tears in her eyes, "Doctor, we had no idea any of this could happen. Nobody warned us. I am here today to warn you. I have spent over 2 decades working inside hospitals, and I want to tell you the truth that not enough doctors take the time to say out loud. Hospitals save lives every single day, and I am deeply proud of the work we do. But hospitals are also complex, fast-moving, high-pressure environments where things go wrong, where seniors are especially vulnerable, and where the system itself, if you do not know how to navigate it, can work against you instead of for you. This is not about blaming doctors or nurses. The people in those wards work incredibly hard. This is about the gaps, the blind spots, the traps that swallow senior patients whole, and what you and your family can do right now to make sure you never become another Harold. So stay with me, because what I am about to share could literally save your life or the life of someone you love. The first trap is one I call the medication waterfall, and it is one of the most dangerous and most invisible things that happens to seniors inside a hospital. Here's how it works. You come in with one problem, let us say chest pain. The hospital gives you a new medication. That medication causes a side effect, maybe dizziness or confusion. The next doctor on shift sees the confusion and prescribes something to manage it. That second drug causes low blood pressure. A third drug is added, and on it goes. Before you know it, you are on 6 new medications, you are falling down in the hallway, and everyone is scratching their head wondering why you are getting worse instead of better. This happens to seniors at an alarming rate because older bodies process medications completely differently than younger bodies. The kidneys slow down. The liver is less efficient. What is a normal dose for a 40-year-old can be a dangerous overdose for someone who is 75. And in a busy hospital where there are 3 different doctors managing your care and none of them has the full picture, these dangerous combinations slip right through. What you must do is this. Before you go into any hospital for any planned procedure, write down every single medication you take, including over-the-counter drugs, vitamins, and herbal supplements. Bring that list with you. Keep a copy on your phone and give a copy to a family member. Every time a new medication is prescribed to you in the hospital, you or your family member must ask the doctor or nurse 3 questions. What is this for? What are the side effects? Does this interact with anything I am already taking? You have every right to ask those questions. A good doctor will welcome them. The second trap is something called delirium, and if you have never heard of hospital-induced delirium, please pay very close attention right now. Delirium is a sudden state of severe confusion, and it affects up to 50% of hospitalized seniors. That is not a typo. Half of older patients in hospitals will experience some degree of delirium during their stay. And the terrifying part is that most families do not recognize it for what it is. They think their loved one is just tired, or adjusting to the medications, or maybe the dementia is getting a little worse. Think about what a hospital does to an older person. You take someone out of their familiar home environment. You put them in a bright, noisy room where the lights never fully turn off. You interrupt their sleep every 2 to 3 hours for vital signs and blood draws. You give them powerful medications. You remove their glasses, their hearing aids, their dentures. You isolate them from their family. You have a different nurse every 8 hours and a different doctor every day. The human brain, especially an aging brain, can completely unravel under those conditions. I remember a patient named Dorothy, 78 years old, a retired school teacher, sharp as a tack before she came in for hip surgery. By day 2, she was telling me the nurses were trying to poison her and that her late husband was visiting her at night. Her family was devastated and confused. That was hospital delirium. And the good news is that with the right precautions, it is largely preventable. If your loved one is going to the hospital, bring their glasses and hearing aids. Bring familiar objects from home, a photograph, a small blanket, something they recognize. Advocate for them to be near a window with natural light. Ask the nursing staff to minimize nighttime interruptions where it is safe to do so. Have a family member or trusted friend visit as much as possible and reorient them to where they are, what day it is, and that they are safe. These simple things make an enormous difference. The third trap is one that almost nobody talks about, and it has cost seniors thousands and sometimes tens of thousands of dollars. It is called observation status, and it is a billing classification that sounds completely harmless but is anything but. Here is the situation. You come to the emergency room. The doctors are concerned about you. They admit you. You spend 3 nights in a hospital bed, receiving hospital care, eating hospital food, being monitored by hospital staff. You are in the hospital. You feel like a hospital inpatient. You are dressed in a hospital gown. But on paper, technically, you were classified not as an inpatient, but as an observation patient. Why does that matter? Because Medicare only covers skilled nursing facility care after a qualifying inpatient hospital stay of at least 3 days. If you were under observation status, those days do not count. So if you then need to go to a rehabilitation facility after your hospitalization, which seniors very often do, you could be stuck paying the entire bill yourself. We are talking about costs that can reach $300 or $400 a day or more. Families have been financially devastated by this. Here is what you must do. As soon as someone is admitted to the hospital, ask directly. Ask the admitting doctor or the charge nurse, is this patient being admitted as an inpatient or as an observation patient? Ask it in those exact words. If they say observation, ask why and ask whether it can be changed to inpatient status. You can appeal this decision. You have the right to receive a written notice called the Medicare Outpatient Observation Notice, and you have the right to appeal it. Knowing this one thing alone can save a family from financial ruin. The fourth trap is hospital-acquired infections, and they are far more common than the public realizes. Every year, about 1 in 31 hospital patients in the United States has at least one healthcare-associated infection on any given day. For seniors whose immune systems are already less robust, these infections can be life-threatening. The most common culprits are urinary tract infections from catheters that stay in too long, pneumonia from being bedridden, and the terrifying Clostridioides difficile infection, commonly called C. diff, which can cause severe diarrhea and is extremely hard to treat once it takes hold. Let me tell you about a patient of mine, a 68-year-old retired firefighter named George. He came in for a straightforward colon surgery. Recovery was going well. But nobody removed his urinary catheter on day 2 as they should have. It stayed in for 5 days. By day 6, he had a serious urinary tract infection that spread to his bloodstream. What should have been a 5-day hospital stay turned into 3 weeks, and he went home weaker than he had ever been in his life. Here is what you or your family advocate must do. If your loved one has a urinary catheter, ask every single day, does this catheter still need to be here? That question alone, asked firmly and politely, has been shown in medical studies to significantly reduce catheter-related infections. Make sure every single person who enters the room washes their hands or uses hand sanitizer before touching the patient. You are allowed to ask that. You are allowed to say, "Excuse me, did you sanitize your hands?" That is not rude, that is life-saving. And if your loved one is well enough, get them moving as early as possible. Lying completely still in a hospital bed for days is a recipe for pneumonia, blood clots, and muscle deterioration. The fifth and final trap is what I call the discharge cliff, and it catches families completely off guard every single time. The hospital has decided your loved one is ready to go home, or to a rehabilitation facility. The doctor signs the discharge papers. And then someone walks into the room with a stack of papers, talks very fast for about 4 minutes, hands over 12 different prescriptions, a list of follow-up appointments, wound care instructions, and dietary restrictions, and then says, "Do you have any questions?" And your elderly mother, who has been in a hospital bed for a week, who is exhausted and medicated and overwhelmed, says no and signs the form. 3 days later, she is back in the emergency room because nobody understood how to manage her new medications. Nobody caught the warning sign that her wound was getting infected, and nobody realized her follow-up cardiology appointment was actually urgent and not optional. Poor discharge planning is one of the leading causes of hospital readmission in seniors, and readmission is dangerous. Every time an older adult goes back to the hospital, the risks compound. The infections, the delirium, the medication errors, all of it starts again. Here is what you must do. Before discharge, you or a family member needs to sit down with the discharge nurse or care coordinator and go through everything line by line. Ask what is the one warning sign that means we need to call 911 immediately. Ask what changes in condition mean we need to call the doctor's office. Ask which follow-up appointments are urgent and which can wait. Ask for a medication reconciliation, which is a complete list of every medication they should now be taking and every medication they should stop taking. And make sure there is a concrete plan, not just a vague intention, for who is going to help care for this person at home. If you are being sent to a rehabilitation or skilled nursing facility, visit it before your loved one arrives if at all possible. Ask about their staffing ratios, their infection rates, and their readmission rates. You are a consumer making an important choice for someone you love. Ask the hard questions. Now let me bring this all together for you, because I know that was a lot of information, and I want you to leave here with something clear and actionable. You are not powerless inside the hospital system. You never have been. But the system does not always volunteer the information you need to protect yourself. You have to ask for it. You have to advocate. You have to bring someone with you who can be your voice when you are too sick or too tired or too medicated to speak for yourself. Write down your medications before you go in. Ask about observation versus inpatient status the moment you are admitted. Ask every day whether that catheter still needs to stay in. Make sure someone visits your loved one regularly to monitor for confusion and delirium. And do not let anyone hand you a discharge packet and rush you out the door without sitting down and going through every single instruction clearly and slowly. Harold, the man I told you about at the beginning, eventually recovered. It took months. His daughter told me afterward that she wished someone had sat down with their family before the surgery and told them exactly what I just told you. She said they felt completely blindsided, not by the surgery itself, but by everything that happened around it. You do not have to be blindsided. Knowledge is protection. Advocacy is medicine. And sometimes the most important thing a patient or a family member can do is look a doctor or a nurse in the eye and say, "Wait, I have a question." Your health and the health of the people you love is worth every single one of those questions. Stay safe, stay informed, and please share this with every senior and every family member you know, because this information belongs to everyone.